Good evening, everyone. Thank you for joining us today on CAN TV. This is the Equal Hope segment. My name is Leilani Laxon, and I'm the Data and Communications Coordinator at Equal Hope. And our guest today is Jamie Cernek, who is our Policy and Advocacy Staffer at Equal Hope. For those of you who are tuning in for the first time, welcome. For those of you who have watched our show in the past and are tuning in today for the first time in a long time, welcome back. So just to give a rundown on who Equal Hope is and the work we do, we are a non-for-profit organization that formed in 2008, and at the time we were called the Metropolitan Breast Cancer Task Force. And our mission is to eliminate disparities in Illinois and save lives by offering access to services for people who are uninsured. These services include free mammograms, free cervical cancer screenings and follow-ups, health education, placing people in medical homes so that they have a primary care provider, and we're also helping people with scheduling their COVID-19 and flu vaccines. So our team is of a diverse group. We have people from various backgrounds and educational backgrounds. We have the outreach and educational team who go out into the community and tell people about breast and cervical cancer and tell people about the resources that we offer. We have bilingual navigators who help patients get the resources they need in order to have breast and cervical cancer screenings, and they also help with scheduling appointments and follow-ups. We have advocacy staff, of which Jamie is part of, and they empower people to pursue change. And lastly, we have our research and quality improvement team who look at research and try to understand the root cause of health disparities and find ways to reverse structural racism. So let's get to know Jamie. Jamie, thank you for being on the show. Welcome.
Yeah, thank you for having me.
So tell us about yourself.
Absolutely. Well, again, my name is Jamie Cernek. I'm an attorney and community organizer who's been spending the past 6 years of my life working to change the systems, whether that be clerking in Congress or organizing with my neighbors and community members in my home neighborhood of Uptown Chicago. I'm really passionate about people-powered movements towards justice. So that's led me to Equal Hope as the Policy and Advocacy Staffer, where I work on the Equal Voice program. And as you mentioned, Leilani, at Equal Hope, we're focused on not just putting a Band-Aid on the problem. We know that many problems in our healthcare system, a lot of the reasons why there are health disparities in the city of Chicago between Black women and white women, especially in terms of breast cancer mortality rates, is because of racism in the healthcare system and in our laws and policies. So my job at Equal Hope is to target those policies that lead to those effects in the healthcare system. And I do that by working with and helping to train the people who are at the center of the movement. So we really take community members and leaders, those who have been most impacted by racism in the healthcare system, to be the ones who are truly affecting change. My job as the policy and advocacy staffer is to help support them in that.
Okay, so how does your background and training as a lawyer, how do you put that to use in your current role?
That's a really great question. So I think the best place to start is with what Equal Hope's theory of change is. And a theory of change is how you get from point A, where the world as it is, to point B, which is our vision for how the world should be. And at Equal Hope, our vision for how the world should be is a world free of discrimination and oppression against Black people and people of color, a world where everyone has the resources and care they need to lead healthy, safe, fulfilling lives. And so our theory of change, I have to say, is pretty bold for a nonprofit, for an organization that's in the healthcare space. So we believe, as I said, in not putting Band-Aids on problems. We're really looking to change systems, whether that be through City Council in Chicago, the municipal level, or whether that's going to the General Assembly at the state level and working with the legislators to create change there. So my role as an attorney is definitely a supporting one. I use my legal training to do things like research current policies to determine where they need to be changed and how they're creating those health outcomes that are disproportionately adversely affecting Black people and people of color in Chicago. I also do things like form relationships with legislators. I take meetings with them and strengthen the relationship between us and their office. I also do things like staff our Advocacy Council program, which is my favorite thing that I do. That is creating an advocacy and community organizing training program so that we can make sure that community members are properly prepared to go and advocate for health equity changes. So that's where I see my training as a lawyer really coming in handy, where I can, read a statute very quickly and give a proposal or an analysis. But I definitely see myself in a supporting role to the people who are on the front lines of our health equity movement.
Great. I remember earlier this month we created some text to send to the different wards and aldermen. So that was my experience. Talking with people from the different wards, but I know that you work with them a little bit closer than I do. Can you talk about that?
Absolutely. So for those who aren't aware, Chicago City Council is a little unique from other city councils around the country. So we have 50 aldermen. That's kind of like a city councilor. And each alderman is elected to a particular ward. That's kind of like a district. So the aldermen are kind of like the mini mayors of their ward. They're in charge of constituent services, whether that be picking up the trash, whether that be making sure that the streets get shoveled, filling potholes. It's also about connecting constituents with services that might help them, so connecting them with community organizations and other governmental agencies to make sure that they are getting the resources they need. So a big part of what I do in my role, along with our community organizer, is reach out to those offices to let them know about programs that Equal Hope can give to their constituents, whether that's the mammography services or cervical cancer or even education services, community outreach. I think that our older people are always really excited when we reach out because, our community outreach and education team is so enthusiastic and well integrated in communities that we serve. So that's a big part of what I do with the Alder's office. Another part is in regards to policy. So unlike other city councils around the country, aldermen in Chicago don't actually do much in the way of legislating. But when they do, it's usually around budget season, which happens towards the end of the year every year. And that is when money is allocated to different departments and different organizations across the city. So the main part where I interact with aldermen legislatively is by taking meetings to advocate for our positions during budget season. So for instance, this year, the Chicago Department of Public Health actually cut breast cancer care funding, which was really surprising because we're in the middle of a pandemic, and a lot of people, especially last year, did not go get their cancer screenings, somewhere between 80 and 90%, which is a really big problem because if people don't get their catch-up screenings, that means we're going to have a lot of undiagnosed cancers that might get to a later stage and become harder to treat. So we're going to have a lot of people probably going to be Black and people of color in the city of Chicago if we don't do something about it. And so when we heard that funding was going to be cut, we at Equal Hope jumped right to it. We knew that there was a problem that needed to be solved. So we identified several aldermen who had, more power on committees, which are groups of alder people who help pass along legislation in certain subject matter areas like health or the budget. We took meetings with them. We told them our position, what the problem was, and how we thought it should be solved, which is reinstating the funding amount for breast cancer care services. And lo and behold, those meetings really worked out. We were able to convince the aldermen that this was serious, and in this upcoming year, that money will be restored. So those are a couple of examples of how I work with alder people at this stage.
I remember you sent out those postcards.
Yeah, that was really fun. So like I said, I really believe in the power of people. And so not only were we taking meetings with the alders, myself and the executive director, but we were going out to the people to let them know what was going on. And every single person we talked to said, "Oh my gosh, what are you talking about? They're cutting health healthcare services in the middle of a pandemic. So we actually collected almost 500 postcards from community members urging the mayor, urging city council to reinstate this funding. Many of these people who signed these postcards were either cancer survivors themselves or have otherwise been deeply impacted. And so we knew that this was coming from the heart, and I really believe that, that's what put us over the edge in terms of really convincing city council and the mayor that this is a problem that needed to be solved.
So talk about the projects that you have going on right now with Equal Hope. You did mention Advocacy Day earlier.
Yeah, so my favorite project that I work on is Advocacy Council. In the past, it used to be a leadership development training program where we helped to educate folks on how to be great advocates. What's an advocate? An advocate is someone who is able to argue for a position in front of people of power, in front of those mechanisms by which they can get the policy they want to get passed. So in the past, that used to look like a training program that culminated in sending a huge busload of people, of cancer care advocates, down to Springfield, where the Illinois General Assembly meets and passes laws. So we would always send busloads of people down there to advocate for really important services, like the Illinois Breast and Cervical Cancer Program. And we're actually changing that this year, which I'm really excited about. We are making it an even stronger program that truly centers community members. And so not only are we going to provide training and resources, not only are we going to bring in experts in advocacy and community organizing, but we're going to facilitate more community organizing around the year rather than just one day in Springfield. So I'm really excited for the projects that we're going to be able to come up with, the discussions we're going to be able to have about health equity, and how our vision for how this city and state should look like. Other projects I'm working on include one that's really challenging. So I'm talking a lot about, how do you get a law passed? What happens when the law passes the state house, it passes the state senate, the bill is sent to the governor's office, it's signed into law, but then no one does anything about it? That's kind of a weird situation. You can do a couple of things. You can file a lawsuit, or you can pressure the agency that's in charge of implementing that law. So Equal Hope found itself in this situation when we helped get a series of laws passed about 7 to 10 years ago that would increase health quality of breast cancer screenings and treatment, as well as patient navigation, which is something that we do a lot of over at Equal Hope because it works. And that those laws were actually never implemented by the state agency that was supposed to do so. So that means the state agency had a duty under the law to create a program or to expand a program, and they never did. And that is really unfair because we already found a solution to problems that were creating a disparity between black and white women, especially in the city of Chicago, in terms of mortality rates from breast cancer. We found the solution. We were able to convince legislators to agree on it. It passed almost unanimously. And then once we passed the law, the department kind of just walked out the door. So right now we're really working on taking meetings with legislators to try to push them to push the Department of Healthcare and Family Services to implement this law, to give thousands of women across Illinois a fighting chance at surviving breast cancer. So those are probably the two biggest projects I'm working on at the moment.
Yeah, did you have a role in the eviction moratorium?
So eviction moratorium, it's good that you bring that up. So another thing we do is work on what are called social determinants of health. What's that? Social determinants of health are factors that outside the healthcare system that influence your health. So things like housing. If you are someone who's been evicted, you no longer have access to safe, affordable, quality housing. That really takes a toll on your health, as you could obviously imagine. Other things apply as well, such as food insecurity, environment. If you live next to a chemical plant that releases a lot of pollution, that obviously affects your health too. And so when the eviction moratorium at both the federal level influenced by the CDC, and at the state level, written into law by Governor Pritzker. Both ended on October 3rd, which was a huge travesty for everyone in the state of Illinois and across the country. That basically meant that eviction proceedings that were filed during the pandemic and maybe had gone through a court process and given an order, the eviction moratorium actually basically stopped that order from being carried out. So it meant that no one could actually be removed from their homes. And when that moratorium was released, that meant that, the sheriff's office could carry out that order. And that, as we see going into winter, is going to cause a lot of families a lot of harm. No one should be removed from their home, especially in a pandemic. And we know that not only are you losing your home, you're putting yourself at, not putting yourself, the sheriff's office and the state is putting you at risk of worsening your health too. And so we let our clientele, we let our email list know that this was happening, and we were able to also provide more specific housing resources for people who needed that as well. So that's definitely an area I would like to see Equal Hope move more into, and I think we've been moving in the pandemic towards identifying where people need more help with social determinants of health, and I think that's going to be a big area for us in the future.
Definitely. So what are some ideas do you have for projects that you'd like to work on for Equal Hope?
Yeah, that's a great question. So the 2022 legislative session in the Illinois State House is coming up. It'll start in January, and we have a lot of great ideas to bring to the table, including a lot to do with cervical cancer. As we know, and as I'm sure you'll hear all season long, cervical cancer is 100% preventable. And so we've got a shot that if you take it, you can actually prevent for really great chances of not getting cervical cancer, which is a huge innovation in science and technology. So our job now is to make sure that everyone gets the shot. Everyone is educated about it. Everyone knows that it's safe, that it's good for you, it's good for your health, and that we expand access to it so that everyone can get it. There's no barrier in terms of money, in terms of race, in terms of gender. Everyone has access to it. And so we have a couple of policy ideas related to that that we'll probably bring forward in terms of improving access and increasing awareness of how great this is.
Great. So what are some of the projects that you're most proud of while working at Equal Hope?
Yeah, that's a great question. I would have to say the reinstatement of the breast cancer care funding at the city level. It was really exciting. As I said, we really went everywhere with those postcards, and actually it wasn't even me going out into the community. My favorite part was seeing everyone who works in our community health team, who's really out there on the streets, out in the field every day talking with people. That made me so happy to see how many postcards they were able to bring back at the end of the day, to hear about all the fantastic conversations that those postcards sparked, where people didn't know that breast cancer funding had been cut. They would never have known had we not been out there telling them, and how enraged they were at that. And it just kind of made me think about, the disconnect between how, if more people knew about more injustices in the world, how much more people power and energy we could direct towards rectifying those injustices. So, and it was really cool to pose with a stack of 500 postcards.
It's on our Instagram, by the way, Equal Hope _IL.
It was really fun. 500 is a lot. So that was definitely my favorite part.
Definitely. Yeah, I remember taking that picture and seeing all those cards. That was really an achievement.
Yes, yeah.
So what are some ways that people can be advocates for themselves when it comes to their health care and their rights? What are some little things that people can do?
Yeah, that's a really great question. I know it can feel really scary going to the doctor, going to a hospital. You don't feel well. You know that there's something wrong, and you try to help yourself, you try to make yourself better by going to a provider's office, and maybe you're not getting the response you want. That often is a result of racism or sexism. And so I would say for anyone who goes through that, but especially women, especially people of color, you know yourself best, and so it's okay to push back and advocate for yourself. Don't feel that you are, going to make the doctor feel bad, or you're not, you are not actually feeling what you're feeling. You know yourself best, and so I would say go ahead and keep pushing back if you hear something that you don't necessarily agree with. I would also say bring a friend or family member along with too. But beyond that, beyond just the doctor's office, and I'm not a community health worker, so I'm not the best person to ask about that. But outside of that, I would say get involved with a local organization so that you can stay very involved with news regarding health equity. You can hear about things that happen, such as the proposed General Iron plant moving from Lincoln Park to the southeast side. And you can hear how horrible that would be for the communities of color in that area, and the health impacts that would have. Joining an organization is really great because then you can act as quickly as possible. You can make sure that the people in power know how you feel and how you think that the situation should be rectified. Those are probably the ways I would say you can best be an advocate for yourself in the health system.
That was going to be one of my questions was, how about if people in a neighborhood, they see some discrimination, racism, something that they don't like, how can they rally together and make a difference and be empowered?
Yeah, that's a fantastic question. I'll say Chicago is really fantastic because there's an organization for every block. So if you see something happen, something you experience, the racism in the system, there are so many people in your neighborhood probably who've had the same experience as you that you can band together with to affect change. Like I say, people power is the best power. So if an organization doesn't already exist in your neighborhood, get a group of people together to come up with a plan, whether that's protesting in front of the alderman's office or protesting in front of another location. Targeting the people in power who are making the decisions that are adversely affecting you, I always think is the best path forward. You can do other things like canvass your neighborhood and talk to people on the street to see if anyone else has had the same experience as you, to see how they feel about what's going on. I know up in my neighborhood, one particular piece of legislation that my community group really wanted to get passed was community accountability over the police. So every weekend we were out canvassing the streets. We were talking with neighbors about their experience with public safety and the ways in which that affects other areas of life. So, if Chicago spends a lot of money on the police and public safety, that means there's a lot less money to spend on things like health. So having those conversations with neighbors, having those conversations with people who never would have known that this piece of legislation was on the table until we came up and talked to them, that was really powerful. So talking to people in your neighborhood and knowing that you're not alone and targeting people in power, that's the way to do it.
So starting from the ground up.
Yeah.
Basically.
Yeah.
What about petitions, having people sign petitions? Do you think they're effective?
I think so. I think it shows a really big group of people wanting something. And more than that, being very clear about what they want. So if you have a petition that outlines exactly what you want that politician to do or that business owner to do, they can really see that you've got a lot of people on your side. So I really like petitions. I think they're a great tool.
Good. What if someone wants to learn more about advocacy and how they can really get involved with wards and aldermen? What resources do you recommend?
That's a really great question. If you're interested in getting involved with health equity advocacy, you should call Equal Hope and let them know that let whoever answers the phone know that you want to be in Advocacy Council. That's an organization right there where we're going to be organizing for change at the city level, at the state level for health equity sources. I would also say check out Facebook. Look at groups for organizations in your area. I know Chicago is a big organization town, so I know for sure that you'll be able to find something.
Right. So anything else that you would like to say about advocacy and the work that you do for Equal Hope?
Yeah, I find the work that I do extremely fulfilling. I really love my favorite part of Equal Hope is seeing all the really great work that our community health workers do on the front lines, all the great conversations that they have with community members and people impacted by a racist healthcare system. So for me to be able to be there to support all the work that they do, as well as support our community members who are advocating on the front lines as well, that makes me feel really happy. And I think that's an area where, if you want to create change at the highest level, you should look into doing some advocacy and organizing work.
Great. Are there any organizations that you volunteer for? Some organizations that people would like to get involved in so they can get their feet wet if they want to do some advocacy work?
Yes, I would say look at your block club. That's a club that's usually about 4 or 5 blocks in length, that's made up of groups of neighbors. And so they, a lot of the time, will be interacting with the aldermen about things happening in their particular neighborhood. So whether or not they want a building to go up, zoning, or other things that are happening on a hyper-local level. That's where I would say to get involved with.
Great. Okay, so just thinking what else we can talk about. I think we ran out of questions. This was a really great discussion. If people want more information about Equal Hope and the work we do, they can go to the website equalhope.org. We have lots of great resources on there. You can find out about how to get a free mammogram, free cervical cancer screening, more information about the services we provide. You can learn about who we are because all our profiles are up there. You can also contact us at 312-942-3368, or you can email us at info@equalhope.org. We also have social media. You can find us on Facebook, you can find us on Twitter, Instagram, TikTok, and YouTube. So our show will be on every 4th Tuesday of the month, so you can expect to see us around the same time next month. I believe it's December 21st. Okay, so thank you again, Jamie.
Thank you for hosting.
It was great to have you talk about the work that you do and the work that we do at Equal Hope. I think people have learned so much from us and how to get started in advocacy work and policy work. If you have any questions, feel free to call us or email us at Equal Hope. We're in the office from Monday through Friday, 9 to 5. Thank you and have a good night.